Today, Great.com talks with Mickey Burns, who's the Chief Clinical Officer at Judis House. If you haven't heard of them, they are a non-profit organisation on a mission to help children and families grieving a death find connection and healing. If you are new here, please press subscribe on YouTube or in your podcast app, because today we learn why we must support children grieving a death loss. Hello, Mickey, and welcome to our podcast.
Hi, Ryan. It's my pleasure to be here. Thank you.
Thank you, Mickey. And I really look forward to having this conversation because for me personally, this sounds like it is a very, very important organisation that you have here. So to start with, for me and anybody new here, what is Judis House and what do you do?
Judis House is a nonprofit in Denver, Colorado in the United States. And as you mentioned, we exist to serve children and families who are grieving a death loss. And we serve youth ages 3 to 25 and their caregivers through a program that we've created and developed. It's a 10-week program, 10 sessions. Families come together, so everyone in the family, including the caregivers, come and learn about grief and how grief can be a difficult journey and how it can be a rewarding journey. In addition to that, we also have an evaluation and research arm. So we are constantly looking at the data that we collect from our families and also just data in the community about grief and loss. And we have a training and education arm. So we offer trainings and educational workshops and consultation and outreach to individuals throughout the United States, Canada, and sometimes even over in the UK where you are, Ryan.
Wow, thank you so much for sharing that with me. And sort of like what you do obviously is very, very important, but why would you say that is so important to say support the children that are grieving? And it goes from a wide variety of ages up to the ages of 25. So why would you say that is so important to support those individuals?
You know, our developmental progress through life has many opportunities for learning and growth and resilience. And it also has many opportunities to get derailed. And what we know through the research that we've done at Judis House and the research that other individuals have done is that when a child experiences a significant death loss in childhood or young adulthood, it can significantly derail that development, leading to all kinds of different challenges like dropping out of school, not being able to hold down a job, not being able to sustain relationships, depression, anxiety. There's actual research that shows if a child experiences a death loss in childhood, the death of a parent or a sibling, you actually are prone to earlier mortality. And I think in a day and age like the one we're living in today, where we were all coming through the COVID-19 pandemic and we're at different places across the world in terms of what coming through really means, we know that there has been a significant uptick in bereavement for children. There was an article in the New York Times yesterday. It was an opinion piece, but it was saying that over 1 million children worldwide are bereaved because of COVID. In the US, we know that 1 in 14 children will experience the death of a parent or sibling by their 18th birthday. And that's information that we've derived from a tool that we created here at Judis House and our research arm, JAG Institute, called the Childhood Bereavement Estimation Model. And so we know that if we have the propensity for all of these negative outcomes for children who've experienced a death loss, we need to have resources to be able to help prevent those negative outcomes. And that's what we have the pleasure of being able to provide to our community here at Judis House.
Yeah, and wow, like those figures that you just mentioned there are very, it's quite, I'm trying to think of the word to use, like it's hard to hear that. There's so many children obviously that will experience a loss of a loved one throughout their lives, because we all know that, say, usually the child is meant to say bury their parent, etc. And in this case, this isn't the case. So that's so hard to hear that the numbers are that high. And it's great as well that they've got, say, people like you, organizations like you to offer that support. So what would you say that some of the greatest needs of those individuals that you support and serve are? And sort of how are you part of the solution?
That's a great question, Ryan. What we find that the children need and the families, that is, they need a compassionate response to loss. Unfortunately, because death and the idea of thinking about not being here is so frightening to all of us, we often avoid the topic and it becomes rather taboo. And when you add to that the different ways that individuals die, that can make things even more isolating. So, if, for example, a child experiences a death loss by suicide, that's something that we're not really comfortable talking about and not really sitting down with somebody and saying, tell me about how you're doing and tell me how you're managing all of the questions that come with that type of a loss. And so, what we've really worked to do is to provide that compassionate, empathic response to the children and the family by having the families come together where everyone is coming and experiencing the same information and the same process in a way that's developmentally appropriate for them based on their age. We find that families are able to heal together. Everyone grieves in their own way. So the grief reactions of a 4-year-old versus the grief reactions of a 14-year-old versus the grief reactions of a 40-year-old are all going to be very, very different. And so being able to recognize those differences and being able to honor those differences is a really big part of what we are hoping to bring to communities. So in our work, we work with a number of other organizations here in the US. The National Alliance for Grieving Children is a partner of ours, and they have a number of member organizations across the country who provide this type of compassionate support to families who've had a death loss. We also work really closely with the New York Life Foundation, who have actually helped us to create that childhood bereavement estimation model. And in the US, they're the largest funder of childhood bereavement resources. And we hope that by doing this work, by doing the research, and by showing communities that a strong response where we're not afraid to talk about death and loss and grief can make a difference for a child that then makes a difference for our community, that we can bring more individuals to our issue. We can bring more people to see that it is a critical public health issue that we need to address. And by that, hopefully, eventually bring more resources and more financial support to those who are trying to work to make a difference for children.
Yeah, thanks again for sharing that with us, because I mean, it's so nice to hear that there's that support there for people just to be listened to, because I believe like many issues in life can be solved just through the power of just a simple conversation, especially like with something like this with a child. And again, what you said is the grieving for, say, a 4, 5, 10-year-old up to 20, 40, 50-year-old, it's all different. So sort of I want to touch on, say, the mental health side of it. Because I know you also said that you work with other organizations too, like what sort of aftercare support do you offer to, say, the children or the individuals that you work with, based on the mental health side of it?
Mm-hmm. I'm so glad you brought up the mental health aspect. That in the field of childhood bereavement and bereavement in general, there's kind of a number of different positions, where some individuals like to think of grief as a normal, natural reaction to a loss. We're all going to grieve at some point. Sometimes we're grieving a death loss. Sometimes we're grieving the loss of a home. Sometimes we're grieving the loss of a relationship. So we all grieve, and those reactions that we have are normal. And there's a concern about pathologizing normal reactions in the field. At the same time, we know that for some individuals, when your grief reactions become something that keeps you from being able to go through your daily life and really starts to cause dysfunction and disruption, being able to have access to mental health support is really essential. And it's different across the world, whether or not that support is going to be available to you. So at Judi's House, we see our program as both a prevention program, so preventing kids from getting to the place where they have a diagnosable mental health disorder like depression and anxiety. And we also see it as an intervention where youth and adults who already are at that level where they feel like they can't continue to function know that because we have licensed mental health clinicians on our staff, that they can get the level of support that they need. Unfortunately, in the US at least, getting reimbursement from insurance for that type of care has historically not been available. Just recently in May, there have been changes to the diagnostic criteria, and a new diagnosis has been included called prolonged grief disorder. This, of course, has brought more controversy to the field. While some are really excited that there's this diagnosis, and that means that we can start to recognize that grief can become quite a burden in some cases and can need help from clinicians and from doctors and other individuals. Others worry that by creating this diagnosis, we will start to pathologize normal grief. So a big part of what we are doing when we're going out to communities and we're doing this education is trying to help people recognize when is the grief reactions that you're experiencing something that's normal and natural, and that the help of a loving community, a loving family, friends can really help you to move through that. And when are they at a level where being able to access a social worker, a psychologist, a counselor could really help to be able to take on these grief reactions and manage them in a way that allows you to get back to some of the life activities that you've been missing.
Yeah, and thank you again for sharing that with us, because that was very detailed as well. And it sounds like you're looking out for, say, the individuals, the differences, say, in their day-to-day lives, because we all act differently, right, as well, because some individuals might hide it well than others would, and you sort of notice those patterns, you pick up on those patterns, how say the individuals change over time. Obviously following death of a loved one, I'm sure it's awful, and I haven't really experienced that really close to myself. But say if it was, say, a young child that lost, say, a parent, etc., we all go through childhood being raised by a parent, so I'm sure it could be super difficult for, or it is super difficult for those young children. So yeah, again, it's just so nice that they've got that support there to reach out and have those conversations, and yeah, hopefully sort of deal with what they're going through, because again, it's so awful to have to experience that. So I wanted to ask, say, more on your organization side of it. Since its founding in 2002, what have been some of your, say, greatest struggles, and how did you overcome them?
So that's another great question. So we've been around for almost 20 years, which we're pretty proud of, and we've grown every year. And I think there have been many growing pains along the way. So we are here in Denver, Colorado, and one thing that our city has experienced is increased real estate value. And so as we've grown as an organization, being able to have the space and the capacity to be able to meet the need of an increasing number of individuals and families has been a challenge. And so over the years, we've been able to move from location to location and really been able to expand our capacity to serve in that way. We also had encountered at one point, our organization did not employ licensed mental health clinicians at the level that we do now. And what our co-founder, Dr. Brooke Greasy, we were founded by Brian Greasy, a former NFL football player, and his wife, who is a psychologist. Dr. Greasy recognized that the children coming and participating in our groups had an increasing level of trauma, that there was a concern if we didn't have clinicians available to be able to recognize that that trauma was coming through, to be able to have a compassionate response to a child who is maybe experiencing suicidal thoughts, that we ran the risk of potentially doing more harm than good. And so it was probably around 2011 that we made a decision to have a licensed mental health professional or an individual who's training to be a licensed mental health professional in all of our programs. And that has really changed the way we approach our work. And I think finally, any nonprofit probably that you've talked to, Ryan, says there's always difficulty raising the funds. And so we're fortunate to have an incredible development team here at Judy's house who works hard to get the message out, to raise awareness, to have people know that we rely solely on donations and grants from the community. All of our services that we offer are free. And so to be able to keep those services free, bringing in the dollars is really important. So I appreciate you having us here today and being able to talk about what we do, because it's by getting the message out and raising that awareness that we can bring more financial resources to the field.
Yeah, and it makes it's so important, obviously, to have that finance there to help the individuals as well, because you can't help them with no money. So just another question that I'd like to ask, if you've got the facts and figures there, say how many children have you helped in total since you've been running?
Since we began in 2002, we have helped over 11,000 individuals. And it's interesting, we talk a lot about the number of people that we've helped. And as a clinician and as an administrator, I'm always focused not just on the number that we've helped, but the depth of the services that we offer. And so in a typical year, we provide about 14,000 hours of service to our community. And a family on average will stay at Judy's house for about a year to receive the support that they need as they move through their grief. But we're also here whenever they need us. So we let a family know, once you're a Judy's house family, you're always a Judy's house family. And you can come back if, when you hit a developmental milestone like puberty, the grief comes back in a way that you hadn't anticipated. We're here and we'll be able to support you through that too.
Again, that's just so nice to hear that the support's there, like you guys are there throughout the whole childhood. Like the children don't feel like they come to see you, but then they go away and then they can't come back. So again, it's just so nice that, say, the door is always open to help with any issues that they may come across as well. So if you have one, do you have, say, one of your greatest success stories that you could share with us at all?
There's so many, it's kind of hard to choose just one, but I will choose one from when I very first started. I've been at Judy's house for almost 9 years now. And when I had first started, I tend to work with adults. I tend to be working with the parents. But there was a young girl, I think she was about 5 years old. And when she started in our programs, she was having some really significant medical health issues. And so they were running lots of tests at the hospital, doing some gastroenterology tests and really trying to figure out what was going on. And when her family would come, they were like, we got these medical problems going on. It has nothing to do with that this child had lost her father, but we just wanted to let you know that this is another thing that she's having to deal with. And so they started in our program, our primary program. The curriculum that we developed is called Pathfinders. She started in our Pathfinders program. And at that point, she was on adult prescription strength medication for these problems that she was having. She was, I'm pretty sure, 5 years old. And she went through the 10 sessions of the program. And by the end of the program, she was completely off all of the medications, and these tests that they were running where they were not able to find an origin of this difficulty were coming back with, everything's fine. And so what we learned through that process is that while we often think of grief as an emotional reaction, it can have physical impacts on our body. And so for this little one, this little 5-year-old, being able to come to Judy's house and being able to talk about her dad's death and being able to be with other kids and see that she's not alone, she's not the only 5-year-old girl who's experienced the death, helped to alleviate these medical problems that she was experiencing. And if we can do that, if we can just open those doors for conversation and allow communities to begin healing together, to begin embracing those who are grieving in their community, we know that we can make a huge difference.
Yeah, and that's so nice to hear. That young girl, literally, you managed to help her out that much. So it's so nice to hear the impact that you guys are having. So if you could share with us, say, what is your vision for the future?
You know, we are constantly, we have big dreams. We want to go intergalactic. No, I'm just kidding. Our hope is that there is no child alone in grief. Right now, we know that there are children who are grieving in isolation, that they are in communities where they are unable to get the help and support that they need. Even here in the US, one of the wealthiest countries in the world, we have states where there are no grief support services for children, and they happen to be some of the states with the highest childhood bereavement rates. So our hope is that by sending this message out, that worldwide there will be no child who's alone in grief.
Yeah, and that's an amazing vision to have as well. And I'm sure you guys will get there one day. So you're doing incredible things. So if somebody's, say, listening today and they want to help at all, what can somebody do to help, and what action steps can they take to be a part of the solution?
I think the first thing to do is to think about how you respond when you encounter somebody who has experienced a loss. I think we're often afraid to ask, how are you doing? And not just the how are you doing, I'm good, thanks, and moving along, but really taking the time to ask the question and say, no, really, how are you doing? My ears are open. And another thing that we hear a lot from our families is that after they've had a death loss, everyone will say, let me know how I can help. In the midst of grief, it's really hard to think about how other people can help you. So instead of saying, let me know how I can help, maybe offer something that you can do. Hey, can I come over and mow your lawn next week? Hey, can I take the kids for a night so that you can have some time to yourself? These are some actions that families have told us really make a difference in the long run, because trying to process how people can help and actually being able to reach out and ask for that help when you've just experienced a devastating loss can be really difficult. And then I would encourage you to look for grief support centers in your community and see if you can donate your time or donate your financial resources to them. We have a number of resources on our website. It's judishouse.org, and that's Judi with an I. But really educating yourself about what the needs are of bereaved children and families, and then doing your part to meet those needs is a way to help make a difference.
Yeah, that's amazing. And I know you just said your website there, and a moment ago you also said about donations too. So if, say, somebody did want to donate, what's the best way that they can get in touch with you guys?
Going to that website, so JUDISHOUSE.org, judishouse.org. You go there and there's donate button right on the main page. We welcome any donations. We also welcome words of encouragement. We love hearing from people. And if you yourself are in need of support and you don't know where to turn, reach out to us. We can try to help get you directed.
Thank you so much. And for you listening, if you've enjoyed this episode, please press subscribe on YouTube or in your podcast app. That will show the algorithms that this is an important conversation, so more people can learn why the importance of supporting grieving children in need.